You go to the doctor. That's what you remember. One appointment, one waiting room, one person in a white coat. But if you've ever been seriously sick or watched someone you love go through it, you know that's not the whole story. Your body moved through a system. Different physicians, different rooms, most of them people you never met. A primary care doctor who knew your history. An ER physician who had minutes to decide. A surgeon you spoke to once before going under. A radiologist who read your scan from another floor. A pathologist who looked at tissue you never saw. Every time you enter the medical system, you're really entering a chain of physician types, each one trained for a different part of your care. Today, we're walking through all 8. Not every doctor that exists, but the 8 that show you how the whole system works. And we'll follow Sam, one person, 8 different medical costumes through each one. It starts with a doctor you actually know. The primary care physician is your medical home. The person who sees you for checkups, catches your blood pressure creeping up, treats the strep throat, and remembers that you had a weird reaction to a medication 3 years ago. They're not the most dramatic doctor in the system, but they're the front door. When something is wrong and you don't know where to go, you start here. And when something is seriously wrong, they're the person who sends you to the rest of the medical world, writing the referral, sharing your history, making sure the next doctor knows what they need to know. Dr. Paul Farmer spent his career proving that primary care isn't basic care, it's the foundation. He co-founded Partners in Health and showed that the best medicine in the world means nothing if it never reaches the people who need it first. But primary care is built for ongoing relationships, not for the moment your chest tightens at midnight. When care can't wait, a different type of doctor takes over. The emergency medicine physician works in shifts, not appointments. Whoever comes through the door during their shift, car accident, heart attack, broken arm, panic attack, that's their patient list. No schedule, no warning. They triage by severity, stabilize what's life-threatening, and make fast decisions with incomplete information. They're the safety net of the entire system. Primary care is the front door. The ER is the trap door, the place that catches you when the regular system isn't fast enough. Dr. R. Adams Cowley understood this before most people had the words for it. He founded the first dedicated shock trauma center in the United States and built the idea that emergency care is its own specialty, not just regular medicine, but faster. Once the ER physician stabilizes you, the crisis isn't over. If you need to stay in the hospital, someone else becomes your doctor. The hospitalist is the physician who runs your care inside the hospital. Your primary care doctor is back at the clinic. The ER doctor handled the emergency. Now you're admitted, and the hospitalist is the person who sees you every morning, reviews your labs, adjusts your medications, and coordinates every specialist who walks through your door. They didn't coin the term hospitalist until 1996. The specialty is younger than the internet. It exists because hospitals realized they needed doctors dedicated to inpatients, not doctors trying to manage a hospital floor and a clinic on the same day. Dr. Robert Wachter at UCSF helped define what hospitalists do and why they matter. He's also one of the loudest voices in medicine about patient safety, because when one person coordinates your hospital stay, fewer things fall through the cracks. Sometimes during that stay, the hospitalist's answer is clear: you need surgery. The surgeon is the physician trained to operate, to physically fix what medication and monitoring cannot. They evaluate whether you actually need surgery, plan the approach, and perform the procedure. General surgery residency alone is 5 years after medical school. Patients meet their surgeon briefly, a consultation, a consent conversation, maybe a few minutes before anesthesia takes hold. But the operation itself is the product of years of training and a team of people you'll mostly never see. Dr. Atul Gawande is a surgeon who writes about surgery honestly. Not just the heroics, but the systems around it. How checklists prevent mistakes, how the best surgeons depend on the best teams. Speaking of teams, The surgeon is not alone in the operating room. The anesthesiologist keeps you alive while the surgeon works. That's the job, stated simply. They evaluate you before surgery, administer anesthesia, monitor your heart rate and breathing every second of the procedure, and bring you back safely. The surgeon focuses on the operation. The anesthesiologist focuses entirely on your body. And if your blood pressure crashes or your airway closes, they respond in seconds, not minutes. Dr. Virginia Apgar was an anesthesiologist who changed medicine far beyond the operating room. In 1952, she created the Apgar score, a quick assessment of newborn health still used in delivery rooms around the world today. But long before anyone operates, doctors need to see what's happening inside you, without cutting you open. The radiologist reads your scans, X-rays, CT scans, MRIs, ultrasounds. Someone has to interpret what those images show. Is it a fracture or a sprain? Is the mass suspicious? Is there a clot blocking a vessel? Most patients never meet their radiologist. The scan gets ordered, the images get taken, and a report appears in your chart. But that report can change everything about your treatment. Radiologists often work in reading rooms, sometimes down the hall, sometimes in another city entirely. They're one of the most invisible physician types in the system. Dr. Raymond Damadian developed the first MRI machine, giving radiologists a way to see soft tissue, organs, and tumors that X-rays could never show. But when the answer has to be definitive, especially with cancer, someone has to look at the tissue itself. Most people have never heard of this doctor, but your treatment plan may depend on them. The pathologist examines what your body is made of at the cellular level. A surgeon can remove a mass. A radiologist can spot it on a scan. But the pathologist tells you what it actually is, what type of tumor, how aggressive, whether the margins are clean. Patients almost never meet this doctor. The tissue goes to the lab. The report comes back. But treatment plans, chemotherapy, radiation, more surgery, often start with the pathologist's words. The word biopsy comes from Greek, bios meaning life, and opsis meaning sight, literally seeing life. The pathologist's microscope is where that seeing happens. Dr. Net Omalu is a forensic pathologist who identified CTE in football players, chronic traumatic encephalopathy, by looking at brain tissue under a microscope. One pathologist's findings changed how an entire sport thinks about head injuries. The body has been examined, imaged, and treated. But healthcare isn't only about the body. It's also spiritual. The psychiatrist is a physician who treats the mind. Depression, anxiety, bipolar disorder, schizophrenia, these are medical conditions. The psychiatrist prescribes medication, manages crises, coordinates with therapists, and decides when someone needs to be hospitalized for their own safety. Dr. K. Redfield Jameson is a psychiatrist who wrote publicly about living with bipolar disorder while treating patients. She bridged the clinical world and public understanding in a way few physicians have. Physical care and mental care aren't separate stories. They're the same patient. So the next time you go to the doctor, one appointment, one white coat, remember what you might not see. Someone has been your medical home for years. Someone stood ready the night you couldn't wait. Someone managed every day of your hospital stay. Someone operated when nothing else would work. Someone kept you breathing on the table. Someone read your scan from a room you never entered. Someone looked at your tissue under a microscope and named what it was. And someone treated your mind with the same seriousness as your body. It was always people. Different types of doctors, each trained for one part of you, working together so you could get better.